Fentanyl is a powerful prescription pain medication and anesthetic that is part of a family of drugs known as opioids. Doctors prescribe fentanyl to treat patients with severe pain or to manage pain after surgery. Unlike opiates, which are derived naturally, such as heroin or morphine, opioids like fentanyl are synthesized in a lab. Fentanyl has become the synthetic opioid most widely used in medicine, and it has also become the most common cause of opioid overdose deaths in the United States. It is 50 times stronger than heroin and 50 to 100 times stronger than morphine. Fentanyl was first synthesized in Belgium in 1959 and entered medical use worldwide in 1968. Within 10 years, it began to be manufactured illegally, sold, and continues to be used illegally today. Recently, fentanyl is mixed with heroin or cocaine, oftentimes without the user knowing. Fentanyl sold illegally is known as Apache, China Girl, China White, and Murder 8. In 2017, there were more than 28,000 overdose deaths from fentanyl in the U.S., an average of over 75 per day. Fentanyl overdose was listed as the cause of death of pop star Prince and has also figured in the deaths of musicians Lil Peep, Tom Petty, and Mac Miller. More than half of all opioid-related deaths are from fentanyl, often illegally produced. Fentanyl is often disguised as a high-potency heroin. Because it is so much more potent than heroin, many users unknowingly overdose and die. It can be taken in a variety of forms, including a skin patch, injection, nasal spray, tablets, or even lollipops. Accidentally touched fentanyl patches have resulted in unintentional overdose deaths in adults and children. A user can quickly experience relaxation, euphoria, or pain relief with fentanyl, as well as side effects that range from dizziness and nausea to decreased breathing and coma. Users quickly build up a tolerance, which can drive them to want more and more. Fentanyl use can create a dependency, which can result in withdrawal symptoms when its usage stops. Withdrawal symptoms can be severe and differ from person to person. The seriousness of symptoms can depend on the frequency and quantity of use and the potency and form of fentanyl being used. Symptoms of fentanyl withdrawal can vary from mild, moderate, to severe. They can be very unpleasant and even fatal. The symptoms start within 12 hours of the last dose and can last for a week or longer. Because it is such a powerful substance, fentanyl withdrawal can last longer than most opioids, sometimes up to 1 month. Even after the end of the withdrawal process, the risk of relapse remains very high. There are 3 popular treatments often offered to patients struggling with fentanyl addiction. The first option is a form of medication-assisted treatment, or MAT, with replacement opioids like methadone and Suboxone. These substitutes mask the withdrawals and can be used to taper down the dosages of fentanyl. But rather than treating your opioid dependency, you are just replacing one opioid with another opioid. Worse than that, those replacements can easily cause even more serious dependency along with stronger withdrawals. The second option includes either staying in a long-term rehab center, a detox facility, or any other related therapy, which includes methods such as a support group or a 12-step program. In these care facilities, the primary goal is to help the addict with the symptoms instead of treating the lifelong dependency. It's not surprising why 70 to 80% of the participants relapse within a few months after treatment. The third option is to undergo rapid detox, where the goal is to treat the withdrawal and not the root of the dependency. However, this form of treatment is ineffective in the long run. Ultimately, fentanyl addiction should be treated at its biological root, the brain. With the ANR treatment, we can evaluate each individual and restore their own neurological and chemical balance to a pre-dependency state, effectively eliminating their withdrawals and cravings, thus defeating the fentanyl dependency from the root.